Hello, everyone. Welcome to today's Grand Rounds. We have Dr. Patel joining us today. He is a consultant pediatrician and a board-certified lifestyle medicine physician. He is an assistant professor in the Department of Pediatrics at the University of Toronto, and he completed his pediatric residency at Memorial University in Newfoundland. He currently works for Scarborough Health Network and is the founder of the recently launched Reset Pediatric Lifestyle Medicine Clinic. He completed the plant-based certificate program through the T. Colin Campbell Center for Nutrition Studies at Cornell University. He has worked with numerous families and is passionate about giving children and their families the best fuel for the well-being to maximize their potential. He is passionate about promoting a culture of wellness and resilience within physician and trainee communities through medical improv, meditation, and plant-based nutrition. He is a certified yoga instructor and teaches, and I'm sorry if I mispronounce this, Shaolin Kung Fu?
Shaolin.
Did I say that? Sorry, thanks. At the Waterloo Kung Fu Academy with over 35 years of experience. He's happy to take questions when he pauses or at the very end. I'll turn it over to you, Dr. Patel.
Thank you, Kathy. And thank you to the Parry Sound Group, especially Milen, who's on the call, for having me. I really appreciate the opportunity and really excited to share on this topic, which is a passion of mine. There's so much information to cover that I'm doubtful we'll be able to get through all of it, but I'm going to try my best. Hey, Natalie. All right, so here we go. Just going to start off with a land acknowledgement. We're meeting on the Aboriginal land inhabited by the Indigenous people, and the area has been homeland to the Anishinaabe people and has come to be referred to as by English as Muskoka Parry Sound. The Anishinaabe still regard Muskoka Parry Sound and parts of the surrounding area as their traditional territory, and we are grateful for the opportunity to meet here and thank all the generations of people who have taken care of this land for many thousands of years. The conflict of interest, I don't have any financial disclosures. I did want to, as it was mentioned, I recently opened a pediatric-focused lifestyle medicine clinic. And currently, I work for the Healthy Outcomes Pediatric Program for Scarborough, where I provide clinical care to families. This is essentially a lifestyle-focused clinic for children with obesity. The learning objectives have changed slightly since you have seen them on the poster, but the first is to discuss the importance and timeliness of lifestyle medicine in the pediatric population. Second, we're going to try to highlight some pediatric guidelines around the 6 pillars of lifestyle medicine and their relevance to some pediatric chronic diseases. It's also important to understand some key differences between children and adults and applying lifestyle interventions, that it's not the same thing between adults and kids. And then I want to have everyone take away some hopefully tools in their kit on behavior change, how we can identify behavior change, and some communication strategies that we can hopefully apply in our clinical practice. All right, here we go. So just a quick note on my personal journey. When I was a really young kid, I was really active. I was this frail kid who got easily distracted, and I got pushed around for sure. Practicing Kung Fu really gave me an ecosystem to really grow and mature, and really did give me an opportunity to have a positive lifestyle. When I hit the biggest test that I had when I was 18, that was when I was testing for my Black Sash, I really revamped my diet. And since I was 18, that's when I gave up drinking like pop. So I haven't had any since then. And so I spent all of medical school and residency talking to families about the benefits of physical activity and diet. And we all know that residency is a long slog. And when I got to fellowship, I actually myself burnt out. And so for me, lifestyle medicine, where I had to kind of revamp and reinvent myself in fellowship, the principles of lifestyle medicine really provided me a complete framework to really recreate myself. And that was back in 2014. I remember my coach at that time, he says, you've been operating at your way of life for the first 30 some years of life, and now you need a complete new like motherboard overhaul. And so when I came across the American College of Lifestyle Medicine in 2020, really literally my jaw dropped, because it really I saw it as an opportunity to combine all of my personal interests and passions. And for me, the reason I went into pediatrics was to focus on the future generation of health. So it was really the best, the perfect combination to look at this as hopefully what I want it to be, like a full-time focus. So that's just a little bit about my journey and myself. So we are going to jump right into it. Just to lay the land a little bit, chronic disease in children is majorly on the rise. As you can see here, just in reference to obesity and diabetes, as of 2017, nearly 30% of children ages 5 to 17 were overweight, and this has been rising clearly since 2017, since the pandemic. 60% there's a 60% increase of type 2 diabetes amongst Canadian children from 2006 to 2019. And there's notable disparities in incidence amongst certain demographic groups. And finally, in 2021, 22% of children in Canada have at least one chronic condition. So, gone are the days now where children are healthy because they're children, and chronic disease is fully present in a large scale in children. Some other facts and stats to take in are, for example, mental health. The rise of mental health. We know that now nearly 1 in 4 hospitalizations for children, youth 5 to 24, in 2010 we were for a mental health condition. In 2020, we see that on the kids' help phone, twice as many interactions were there for phone calls, texts. And now we know that because mental health is so what I would call crushing in pediatrics, that there's a real struggle for wait times and for kids to get the appropriate supports they need. Again, increasing the why and the urgency for lifestyle interventions in children today. The other stat that I wanted to quote is that they looked at 10 years prior to the pandemic, that feelings of persistence, sadness, and hopelessness, as well as even suicidal ideation, that increased about 40% amongst young people based on the CDC. And that was in the 10 years prior to the pandemic. So we can imagine what it is like now. I wanted to just review a basic definition of lifestyle medicine. Lifestyle medicine is a therapeutic use of evidence-based lifestyle interventions to treat and prevent lifestyle-related illnesses in a clinical setting. It empowers individuals with knowledge and life skills to make effective behavior changes that addresses the root cause of chronic disease. The reason I wanted to mention this, I'm sure all of you in Parry Sound, because of the influence of Mylène and her team, already know this definition, but I wanted to compare it to other things that sometimes get masked or confused with lifestyle medicine. For example, people may have heard the term functional medicine or integrative medicine. And I want to just take a minute to differentiate. Integrative medicine tends to blend complementary and alternative approaches. Functional medicine, there's a strong emphasis on nutraceuticals, supplements, and expensive diagnostic testing, both of which aren't the focus in lifestyle medicine. So I just wanted to take the opportunity to really use other types of platforms in medicine that you may hear about, but are very different than lifestyle medicine. It's really important to talk about the quadruple aim of lifestyle medicine, especially in children, where not only are we striving for better outcomes, which is reversing chronic diseases, we're aiming for its lower costs, but not only will it give patients better patient experiences, there's now a fourth really important arm of lifestyle medicine that's aiming to actually improve the satisfaction and the impact that clinicians are having in their day-to-day practice, because we know that right now the onset and the rate of burnout within medicine is really, really high. So lifestyle medicine can also help address this at the same time. All right, so here are 6 pillars of lifestyle medicine that I just wanted to review for everyone. Again, probably known to everyone on this call: nutrition, physical activity, which are probably the ones that people hear most about. We often talk about sleep in children, which is really, really important. But there's 3 other ones that we also want to shine the light on: risky management, risky substance management, which I'll talk about what that looks like in pediatrics, social connections and the importance of good relationships and how that has such a pervasive effect in the pediatric population, and stress resilience, how children today are managing stress and what the impact of stress is on our developing brains. All right, so here we go on nutrition. So the role of nutrition and how it contributes to chronic disease. I wanted to point out here on this top left, this graph here, what it's showing here is the impact of our diet on the development of chronic disease. I often show this to families because what it's showing here is that childhood nutrition has a huge impact on lifelong health. And what's being shown here is basically the earlier the better. And although it's never too late to start, the earlier you start having good food habits and proper nutrition habits, the bigger the impact. So we see here that actually the impact for chronic disease, it's most set in the first, you can see here in the first 20 years of life. So what we eat in our younger years really set the tone for what happens to our bodies later in life. And we know that, for example, if we look at atherosclerosis and heart disease, that there was studies that have been done, and they've taken through children, very young children who passed away in motor vehicle accidents. They took autopsies of their arteries, and they've started to show now that fatty streaks develop as young as 3 years old. Now, usually when I mention that to parents in the office setting, they're quite shocked, but I start talking about food interventions pretty much right after the age of 1, after, they've stopped breastfeeding or they've, transitioned out of formula. Because again, just to impress them that the time is now, and looking at not only what the foods are, it gives me an opportunity not only to tell the parents what the children are eating, but also reflect back on what the parents are eating themselves. And not only this was a really important graph to look at, but what it's showing here is that the number 1 cause of disability in health right now is dietary risks, even more now than smoking, blood pressure, which have always been the 2 highest. Recently, and this is again now going back to 2017, this graph, but again showing that diet patterns and diet choices have taken over as the number 1 cause of disability adjusted life years in the United States, and this also holds true here in Canada. So again, another graph and visuals that I'd like to point out to families and also to providers is that what we don't always go into the specifics of actually always the specific foods, but I want to show here on the left side that calorie density really matters. So what you have here on the left, you have oil, cheese, meat, and you progress to fruits, veggies. What we're showing here is that the same 500 calories has a big difference in our body, right? And the reason why, from left to right in this first image, is the aspect of fiber. So on the left, oil, cheese, meat do not have any fiber. And when we get into the right side, fruits, vegetables, potatoes, beans, and rice, there's the amount of fiber increases. And what fiber does is it increases satiety in our body. So really the focus is, I never tell families that we are calorie counting at all. The whole goal is to move towards foods that are lower in calorie density that you can eat more of. Right. And so again, we're generally trying not to have so much focus on the number of calories, but again, just choosing the different types of food and being conscious of the types of food that are going in our body. But often we all know that we on this call, every one of us know what the right foods are, but sometimes we don't do it, or many times it's a hard decision to make. Why? And this idea of the pleasure trap, I think, is a really important one to highlight. And so basically the way our bodies are designed is that our bodies are designed to derive pleasure from food. And the more calories, the more pleasure. So if I gave a child an apple, which is, let's say, well, for example's sake, 100 calories, they eat it and they say, okay, that's good. But if I take that same apple now and if I cover it in caramel or chocolate or candy or whatever it may be, that same apple now has become 1,000+ calories. And what happens to your body? What happens to the pleasure centers in your brain? They start exploding. They think, wow, this is the best experience I have ever had in my life, right? This is literally what happens to the brain. But what happens is now your set point of what is normal is from here to here. And therefore, it becomes really hard now for you, for me, for our children to accept that apple again, right? And so the reason why I think, and when I share this with families, they're always just, I mean, I know when I learned about this, my jaw dropped because they explained so much about myself and why it was hard to make the right choices. It's also comforting for parents to know I use this as a platform to say, hey, even if this is the case right now, taste buds and taste habits can be changed. They just require some time. But I do feel that it's important that as parents, we do know this concept so that we can try to create. I always tell parents that the food environment and the food culture is set by the parents. So if we want kids not entertaining certain foods at home, the real work happens in the planning and in the grocery store when we make the choices of what enters the house. Because as soon as it enters the house, I cannot blame, or we cannot blame the child for making the choices they make if it's readily available. So again, this pleasure trap really helps explain why this phenomenon exists. Again, basically what we're showing in these two graphs here on the left side, you'll see the red line that you see is showing numbers from 2004. Basically, it's showing the rise of ultra-processed foods that have increased from 2004, the blue lines being 2015. But we see here that if we see here, like bread and commercial foods have gone up, right? Fruits intakes from here have gone like drastically lower. And again, similarly on this right-hand side, we now know that fruits and vegetable consumption have been declining and has been declining for a while. Canadians reported consuming fewer total servings of vegetables and fruit in 2015 from 4.5 servings per day to what was previously in 2004 at 5.3. And we know with teenagers, consumption has declined about 10% from 2015 to 2021. And pretty much now the majority of people don't meet the guidelines of 8 to 10 cups per day. One thing I wanted to add when I was recently studying for my lifestyle medicine exam was the impact of ultra-processed foods on just our overall health. We know that when people go, there's research to show that when we go from two portions of ultra-processed food to, let's say, portions of ultra-processed food, your increased risk of all-cause mortality goes up by 62%, regardless of any other factor. We also know that just by increasing one portion of ultra-processed food per day, increases your risk per food. It increases your risk of all-cause mortality increases by 18%. So these are really staggering numbers that I think are just important to highlight. That so much of our sodium, I always say that the food industry is controlling us by 3 ingredients: sugar, salt, and fat. And just that if we're aware of these 3 major ingredients that have all the same impacts on our pleasure centers in our brain that give us pleasure as any addictive substance, that we see them and frame them in a different light, and that at least, again, knowledge is power. So we have this knowledge to help shift our decision making. Just moving on. Again, people often ask, what are the foods that we should be focusing on? And I think we can never overemphasize the Canada Food Guidelines. that have made three really big changes in 2019 that were very bold for Canada to lead the way, even around the world. That one, they have taken milk off the Canada food guidelines and replaced it with water. Two, meat has been taken off as a food group and been replaced by protein sources, and specifically plant protein sources. And three, there's been a huge focus on the increase in fiber in our diet. And this has been through increasing where half the plate is now fruits and vegetables. And I do want to focus a major study that was in JAMA in 2020 that even small changes matter, which is really important to emphasize for our families, that for every 3% decrease in the consumption of energy that we switch from animal protein to plant protein, that this is a 10% reduction in all-cause mortality just by this 3%. And if we think about it, 3% is not much. It's not even one meal a week, right? It's even a portion of the meal. So again, if we're compounding small portions of our meals, it really can go a long way to making a big difference. And again, here, this is just from the American College of Lifestyle Medicine. They're trying to take the standard American Canadian diet and show us that by switching to more whole plant-based foods that are minimally processed, we are, as we see here, decreasing the risk of obesity, type 2 diabetes, heart disease, and just overall chronic disease. It can be used for multiple chronic diseases all at the same time. So again, the big point here is start somewhere, start small, and those small changes really aggregate over time. All right, now we're going to get into a little bit of physical activity. We know that physical activity has, before we jump to physical activity, I meant to say food prescriptions. Food prescriptions make a really big difference. As a take home, if you want to know how to write a food prescription, see here on our right, just remember the acronym TAF, the type of food, the amount to have, and the frequency of the intake. So here on the bottom right, this is often the prescription that I use in my lifestyle clinic, and this is from the Plantrition, the organization Plantrition. They have these readily available for physicians. And you see here, not only do they provide resources, but always at the bottom, if we take the example of fresh fruit, I will say, okay, we have fresh fruit, which is a type of food. We're going for half a cup a day or one large handful, and we are doing it 3 days a week for 1 month. And we have shown, studies have shown now that there is improved uptake of behaviors such as diet changes, physical activity changes, when they are written down on a prescription. So again, the take-home point here is if we can be specific in our prescription. If you want to use a SMART acronym, no problem. This is just a little bit simpler to apply into practice. But again, really focusing on at least here for myself and those in the pediatric space to when we write it down, it really does make a difference. I tell parents to put it on their fridge, and it's something that you can always come back to and refer to. Okay, we will move on to sleep. So sleep, I tell parents, sleep, while nutrition is really, really important, just as important, and maybe if not more, is sleep, because I try to get parents to see sleep as a superpower. It does take, like anything, we all need sleep. But it does also, it's a skill. It takes some adjustment of lifestyle conditions and practice. And so really what I want to show here is that sleep in kids is really essential to learning, to memory formation, emotional regulation, physical and mental development. We know the Canadian Sleep Society has shown that 30% of children and adolescents are challenged with sleep problems. That's a lot. That's 3 in 10 kids having sleep issues, where I'm sure most of us probably as kids were doing much better than this. And there's a variety of reasons. Again, in 2019, the American Academy of Pediatrics, they did a study that showed that children aged 6 to 17 are not getting enough sleep. right? We know that sleep, if we see her on the right, it's been tied to academic performance. So when you're not getting enough sleep, this top study was showing that you have a decrease in your grades for mathematics and science. We here see in our second study here that the amount of sleep is impacts your neurobehavioral functioning. So what that referring to your overall executive functioning, decision making, choices, memory, and again, overall executive functioning. And that we know we're able to measure. Although we don't give kids like surveys, we are able to measure fussiness, we are able to measure mood, and this is how a lot of the impact is measured with sleep studies. So again, just wanting to note that sleep is so critical. I often tell families that I want families to see sleep because it has so much like decision making on our executive functioning. I often tie sleep that the better our children are sleeping, that will inherently directly tied to the food choices we are putting in our mouth, right? So the more rested we are, the better choices we can make in terms of what we are consuming and eating. So I want all families to walk away with this understanding of how much we sleep and the quality of sleep is directly impacting the food choices that kids are making. A common question that comes up that I wanted to just put out there, and this can be found on the Canadian Pediatric Society or Health Canada, is just how much is enough sleep. And again, people can just take a look there, the amount of sleep that's needed appropriately for the different age groups. But this is not happening now. And there are multiple reasons for this: excessive screen time prior to bed, irregular sleep schedules, and there's a lot of not only socioeconomic factors. So the sleep varies so much between cultures, and I think really another take home is that we need to be really sensitive when we approach sleep, because culturally there's so much difference in families. I work in Scarborough. Scarborough is like such a multicultural society, high South Indian population, high Chinese population, high African American population. So again, there's such a wide variety, and when that happens, you also get such a difference in how they view and what's normal for them for sleep. And then finally, environmental factors: temperature of the room, the amount of light in the room. These all have to be taken into consideration for reasons why sleep is not happening as well as it could. Most parents don't know that blue light from screens impacts melatonin secretion, and this impacting the ability for their kids to fall asleep. And this is why there's so much emphasis put on no screens before bedtime. As just a very evidence-based strategies that I've taken from a couple of sources that people can take away for themselves. I always say consistency is king or queen, whichever one you choose, but consistency. So bedtime routines, having a routine, even asking about the routine is an important question. Does a routine even exist? The consistent sleep and wake time make so much difference. And even if I've had so much experience with families just applying this one intervention to regulating these two aspects. They come back within like weeks and tell me about differences in their child's sleep. Creating conducive sleep environments. So again, as I was talking before, the temperature, making sure the lighting is appropriate. Again, always thinking about what the noise is. If again, a part of a routine sometimes is a bath or a snack. Again, these are all part of creating the environment. As we mentioned, no screen times at least 1 hour prior to bedtime. Avoiding caffeine in the afternoon or evening is very important for its impacts. Generally, the rule of thumb is that caffeine intake, even for adults, should pretty much your last caffeine should be before 2 p.m. because after 2 p.m., based on the half-life of caffeine, we know that it also has impacts on sleep quality. avoiding napping, daytime napping if you're older than 5. The next is encouraging physical activity in the daytime, so critical and so important to improving sleep. And then finally, simple sun exposure in the daytime. And this becomes even more important, I would say, in the winter time, in the winter months, where we're oftentimes inside. So again, some just big picture strategies that people can take away with them. We will now move into physical activity. I love always talking about physical activity because it's been such a big part of my life and such a big contribution to overall wellness and well-being. But we know that physical activity has such a huge impact, again, with children. First, here we know that's because physical activity is not happening enough due to so many lifestyle changes in today's society. Parents are busier, more screen times, more kids playing in isolation. That sedentary behaviors we now are key drivers of the development of type 2 diabetes in at-risk children and adolescents. We know that regular physical activity has so many great effects. It improves insulin sensitivity, lowers blood sugars, lowers blood pressure, helps with weight control, and many more. We also know that physical activity now is impacting we know there's so much more research on mood, and that depressive symptoms are reduced with those increasing physical activity and reducing sedentary behavior. Asthma is a major chronic disease in pediatrics that is studied, especially in regards to physical activity, because we now know that at least moderate physical activity for 40 minutes, at least 40 minutes per day improves lung capacity and asthma symptoms, even if you have exercise-induced bronchoconstriction, because a lot of times physical activity can be that trigger. So having your puffers is really important. But again, the more we're engaging in physical activity, the more we're building our exercise tolerance. And yeah, so we just wanted to provide a broad scoping view that physical activity really, really matters. And with pretty much every chronic disease is going to have a positive impact. So another question that comes up often in the office setting that is important to refer to is just how much activity is needed. And now there's so much more, not only emphasis on how much we should be moving, but how little we should be sitting. And I think, again, we don't often think about sedentary time because it's we usually focus on physical activity. But again, now if you see all the digital advices and apps, now they focus on getting up, having some movement, the reminders. Again, it's all there to reduce sedentary time. And these can all, for anyone who's looking for these guidelines, this can all be found on the CESP guidelines. They're the Canadian Exercise Guidelines, where all of this can be found. But generally, again, if you're younger than 1, at least 30 minutes of tummy time a day. I'm talking about tummy time as soon as the parents are coming in our first newborn well check after they've left the hospital. Again, as you get older, 180 minutes of any intense physical activity. And again, we start to see now, even after the age of 1, there's no screen time, and as pretty much as little or none sedentary time for more than an hour. And we see now as you get older, more is better, and the screen time, while there is some allowance after the age of 3, it should still be minimized to less than an hour. And again, we see as we're going up in age, again, pretty much from 5 to 17, the general rule of thumb is at least 60 minutes a day of moderate to physical activity, and that 3 days a week, there should be some either very vigorous physical activity and muscle and bone strengthening activities, whether that be climbing, rope climbing, weightlifting, any type of push or pull activity. Again, this is really important for our kids, and that this should be at least a minimum of 3 times a week. And the general rule of thumb is less than 2 hours of recreational screen time. Because what we notice is that when we can all say when you're young, screen time actually is now being used for kids and their learning. But what happens as kids age, that screen time starts going from learning activities to recreational activities. And so just to be cognizant of that shift over the years, and that's why there's so much more focus on minimizing the screen time for specifically recreational screen time. So generally, when I'm with my parents, I generally don't focus so much on what screen time is going into for school, because that has been vastly increased since the pandemic. I really, really try to focus on screen time that's outside of learning time. And one thing that's really important to hopefully as a takeaway that people can take with them is a lot of times families and even clinicians sometimes don't know how to measure what is the appropriate intensity of activity. And I just want everyone to use this simple talk test that I find is really practical and easy to remember for families and clinicians, is that very light to light activity is if you're having a conversation and you're singing during activity, that's light activity. If you are talking but not singing, now we're getting into moderate physical activity. And vigorous physical activity is that type of activity that you cannot speak in full sentences. So again, just having that as a litmus test to inquire with our families and our children about the type of activity, because again, the guidelines are specifically meant for moderate to vigorous physical activity, and we have to make sure that while walking to school and any minimal amount of physical activity we now know is beneficial for all-cause mortality and lengthening life, we do know that to prevent chronic diseases, it is specifically targeting moderate to vigorous physical activity. And this talk test is a simple takeaway, is how you can measure that with your families. Our next pillar is stress resilience. So stress, we know, is, I would say, unavoidable. And we now have proposed mechanisms for how stress is impacting our body and our children's. Since the pandemic, our children the amount of stress is only mounting. So we have to increase we have to up the ante in how we're approaching stress. And I really like this graph that I saw in a study where it showed that the childhood adversity, which we'll get into speaking about, what it does is that it can actually lead to oxidative stress in the body. And this oxidative stress raises chronic inflammation markers, which then have an impact on the mental health symptoms we experience, or the childhood adverse experience can lead directly to our mental health experiences. If anyone hasn't heard this term, adverse childhood experiences really refer to the experiences we have, particularly in childhood, that have long-term repercussions on our overall health and well-being. I really like this picture because it really sums up the 10 different adverse childhood experiences. That the three big categories are abuse, neglect, and household challenges, but that all 10 of these are there, and pretty much, it's well known that 6 out of 10 adults have gone through some type of adverse childhood experience. So one aspect of anticipatory guidance that I really liked in my scouring of the research was that dealing with ACEs, we should really make a focus on shifting and reducing shame and blame when we're dealing with adverse childhood experiences, because what's happening here is that not only children and families, they're having normal reactions and experiences to very difficult situations. And a simple approach that we can take from trauma-informed care, which I think really shifts the lens on our approach, is just starting the conversation, instead of approaching from what is wrong with you to what has happened to you. And again, that just very small shift in language really can be very acknowledging, but also again shift that languaging from shame and blame that we're really trying to be careful about in our addressing of these stress in our children. I would love to talk so much more about the impact of these on adults and teen, but really what I wanted to just focus on is evidence-based coping strategies that we do know about. And this is really the opportunity for us to acknowledge the power of one, mindfulness and meditation, which is growing intervention. I tell not only my colleagues, but also my children that this is so the research now is so focused and pronounced and obvious on the benefits of having some sort of mindfulness meditation practice. I do it really with all of my patients that come through. I have parents and children sit with me in the room, take them through just some mindful breathing and get them to experience it for themselves, because I think having the experience is really helpful. And we know now not only just mindfulness and meditation, but also what we, nutrition. I really appreciated this one study that looked at a group of Seventh-day Adventists and showed that if you had 4 or more adverse childhood experiences, those eating a higher amount of plant-based had a plant-based diet intake have actually 5.5-year longer life. And so the hypothesis was, and with many chronic diseases in pediatrics, such as asthma as well, that it's the high antioxidant capacity, so our carotenoids, our polyphenols that are coming in our plant-based foods and our fruits and vegetables that are giving the capacity to counteract some of the effects of stress. So again, just putting that plug in there for that high fiber diet as a way to also mitigate and help us deal with stress. So just to take a pause here, can someone identify the risky substance in these pictures? Please feel free to unmic and share. This is more for humor. Milen?
I would say that they're pretty much all risky except the kid that has like some sort of lettuce in his hand.
Yeah, there you go. So
But
this
as
is really just more for humorous purposes. What's funny here is that this kid with lettuce and vegetables in front of him seems to be, he seems to be under the most stress. But just identifying risky substances. Initially my idea was like I should have this slide. I should have the kid with fruits and vegetables at least have a smile on his face. But this was really just more for humor. Identifying risky substances. When I think of risky substances in the pediatric population, I think of it in 3 broad categories. The first category I think about is ultra-processed food. That's a risky substance for kids. 2, I think of screen time, and that's very much, I've categorized that as a risky substance in the pediatric population. And the third category that I think of in pediatrics is smoking, vaping, and cannabis use. So again, this picture was just here to reflect those 3 big categories and pick the odd one out. So if we have a chance, because we're coming towards the end, I do want to, if we have a chance, I will come back to risky substances and social connections. But right now, what I really wanted to do is focus on differences between children and adults and why pediatric lifestyle medicine is different. And it's not like how we say, a lot of times our adult colleagues know that internal medicine, pediatrics is not just internal medicine for kids. There's just not many adults, and the same kind of applies. And the reason being is because we have so many other factors to consider with kids that increase the complexity of lifestyle change in children. And this is just a word cloud, just speaking to a few of them. children and their peer influences. The other is, physiologic differences between children and adults, right? Because of the not only changes that the physical body requires, but the transition through developmental stages also changes, and our approach, also changes as we goes through ages. And considering those physiologic differences, we know that cognitive abilities also vary from our young children up into our teenagers. That also makes a big difference in our interventions. What incentivizes children, adults are driven a lot by their social environments, maybe social media. Kids are, again, I tell parents that when our best chances for our lifestyle interventions really are in the kids who are less than, if I had to say, like 12, 13 years old. The reason being is because when you're less than 10, 8 years old, one of your biggest incentives is to please your parents. And that pleasing the parents, their incentive is different than when you get older. And then when that autonomy sets in as a teenager, to just recognize that independence also brings other challenges, right? So again, what degree our parents have with their parenting skills, this also makes a difference in how we approach behavior change with kids. Everything from setting boundaries to modeling. So again, here, this slide here is just to really appreciate that when we are dealing with children and behavior changes, the earlier the better. There's no substitute for positive modeling in parents, and that really are the environments for children really, really make a difference. So as best possible in the home, where at least parents have, families have the most control, is really being conscious of what's in the home environment. So again, I just wanted to put forward these nuances that I'm regularly dealing with families when I'm working with them in our clinic settings. Now going back to some hopefully some tools that people can take away after they leave this presentation. I cannot finish a presentation on lifestyle, even in pediatrics, without mentioning the aspect of behavior change, which is really at the core of lifestyle changes, is looking at behavior. I'm sure everyone has seen the trans-theoretical model for change before. That's probably not new to everyone. But it's really what I wanted people to take away from not only just reminding ourselves of this slide, but being able to identify when we're talking to not only our teenage parents, our children, and our parents, to be able to identify where they're at on the wheel, and then at the appropriate stage of where they're at, to have approaches or ideas by where we can approach our communication to meet them where they're at. So that's really, and so what we're gonna get into now is just really go into what this might look like. So again, everyone knows what these different stages probably mean, but pre-contemplation, from the patient's response, it's either like, I don't need to change, or they don't see even change even in their horizon. And really at this stage, from a physician's perspective, on our next slide, I'll get into what these OR skills are. These are kind of the foundational skills of motivational interviewing. But motivational interviewing is most effective at the pre-contemplation and contemplation phase, if you're wondering where does it insert. But it's really at the pre-contemplation phase. All we can do is respect their autonomy, and we can provide education and ask them how they will know when the right time to make change is. At contemplation, the way we're hearing it is, I want to make a change, but not anytime soon, or I may change. Again, we're using our OR skills, which we'll get into, but this is also the stage of contemplation here to provide resources and encourage some problem solving. That's really how we want to approach when our patients are at the contemplation phase. But if they say, when we ask them, are you open to change? And they're saying yes, then if they're open to making changes and they're open to making changes soon, then automatically that puts them at the preparation phase. And once we know that they're prepared to make changes within the next month or so, then we can move into co-creating of an action plan. And this is really where it's important to talk to parents and families, not just establishing a baseline of where they're at, but also how confident they are in that change, because the research really shows that self-efficacy is the confidence or the ability to know that an individual has the confidence to make a change. And that if we can really work on improving the confidence and self-efficacy of families, this is really where we can make the biggest impact in terms of families developing and adopting behavior change. So again, this is where assessing confidence becomes really important. Action, the patient's response is, I've started making some changes, but I'm not consistent yet. I'm still working on it. And this is where, from a provider's point of view, we look at what's triggering them from falling off the wagon. We try to problem solve with them a little bit. Cognitive reframing is really important, how they look at the potential challenges. This is also where CBT, cognitive behavioral therapy, can be used. And really at this action phase, accountability. I can't stress that enough. But trying to create supports and accountability structures for them is really, when they're in the action phase, as providers, really a really solid place where we can try to help and support them. When patients get into the maintenance phase, we hear, I've been doing this for a year now, or I've been doing this for at least 6 months, even through so many difficult personal challenges or the ups and downs. And when we're here, this is, as providers, great affirmation, acknowledgement, but this is where we're trying to reinforce behavior change. We want to we want to still build on autonomous motivation and increasing their inherent confidence and why, going back to that. And this is also sometimes still where cognitive behavioral therapy is used. So again, I just wanted to have this here as a kind of just a big take home for the language we hear, how to recognize and observe it, and then a potentially stepwise approach. Or skills, these are really, I've just gotten exposed to motivational interviewing in the last few years. I mean, I was introduced to it in residency, and we did need to use a little bit for teenagers. But knowing these skills, I've had to develop it a lot more going through the lifestyle medicine certification, and also just taking courses for myself, because I really feel like I needed improvement in my communication skills to do better for my patients. And these OR skills refer to O for open-ended questions, A for affirmations, R for reflections, and S for summary. And really, here we see that for open-ended questions, our goal is to really hear the patient's story and try not to fact find. Tips to how to include open-ended questions is using like what or how questions rather than why questions, and try to hold back on these. Affirmations are really, really powerful. We've all felt them before, but it's that opportunity to acknowledge and accentuate patient strengths and intentions. And so those typically, if you want to put them in practice, start with you rather than I. I generally refers to more of a hierarchy, whereas you, again, we're moving the physician more into the role of the coach. Reflective statements tend to acknowledge and convey the interest and empathy while also seeking to understand. So again, there's simple reflections. You are upset with yourself, to complex reflections where they will not only acknowledge how they feel, but also add further and provide some further insight into a situation. And then I also really like double-sided reflections, because they have a chance to reconcile the challenges that families are facing, where they want something, but they're still, moving in another direction. So this, on one hand, I'm hearing this, but on the other hand, I really see that you want to move in this direction. So that's what it may sound like. And then finally, summarizing recaps. what patients have shared, and really communicates the importance of being present and listening. That is so, so important for our patients in their journey of behavior change. And so really it's that opportunity to show that we've collected information, we're linking together, and we can also use it to transition. So this is like a very small mini like crash course in communication skills that I think are really, really important, that I wanted to at least share a little bit in our presentation today for people to take away from them, at least to consider, think more about, and explore more in the future. And finally, now I have, over time, tried to compile a list of resources for all of you who have joined and beyond in every pillar of lifestyle medicine, to try to have specific resources in nutrition, risky substances, sleep, physical activity, stress resilience, social connections that I have used for myself in my own practice, and want to share them with everyone else. I think having great resources is really empowering for our patients. Patients, they love it. They feel like they're taking more away from the visit. And if you haven't heard of these, I'm happy, in another discussion to even go through these resources, how I use them, in what situations. But here they are for everyone, for people to see. And I just want to thank everyone so much for listening. I know I ran through a lot of information in a short period of time. I wanted to share so much more. Please visit us at Reset Pediatric Lifestyle Medicine, where I just wanted to show just a very quick bit. What I will share is, and here's my email address that you can use to reach out to me. But one thing I wanted to share is what we're trying to do at Reset. So I'm just going to share my screen again. And so you'll see here one of the strengths that we're offering in our, because I really feel that lifestyle medicine, especially in pediatrics, is I always say it's a team approach. It's a team sport. And I really want to highlight our team members here who are with us on the team starting this journey. We have a long way to go, but we have two social workers on our team. We have a plant-based dietitian. We have a parenting coach, a sleep coach. We have a wellness coach, a yoga therapist, and also one of my martial arts teachers who is there for Qigong, Tai Chi, breath work, and more. And so, yeah, I wanted to highlight our team, a shout out to every single one of them for supporting this cause, and just to show everyone what we're trying to do. So feel free to check out our website and see the different conditions by which you can refer to us for. So I'd love to hear any comments, reflections, questions from everyone that's joined. I really appreciate, I see Shayla and Alicia, two members from our team that have come. Really appreciate that they've come. And yeah, I just want to thank everyone. So please, anything.
If anyone has any questions, please feel free to unmute and ask.
Thank you so much, Rikin. That was amazing. I know we don't have a lot of time. I wanted to ask you what kind of consults you do, and what kind of referrals you've received, and if people wanted to send you a referral, what would be the best way? I know I shared one of your links in the chat, but yeah, just for people who want to send you patients or who want their kids to go through your clinic.
Yeah. So when you refer to, I mean, if you open up the Reset website, you'll see the list of conditions that we look to take on. So far, we have received referrals, everything from patients who are concerned, who want to make dietary changes for weight concerns. That has come through our clinic. I've had GI specialists refer for chronic abdominal pain, because a lot of our families can work with either social workers to help with really just like coping strategies, as well as just breathing techniques to help with this. There's a huge mental health component to both headaches and abdominal pain. For sleep, also, sleep has been a really big. Parents want to find out, one, how they can help their child, with their screen time. So it's a combination of both helping parents with parenting skills, with our parenting coach. Now we realize that because our social worker and our dietitian, they're covered through insurance, I'm covered through OHIP. What I'm really trying to work on right now is so we can increase the exposure of our coaches. I'm starting to pair up with our team members to provide education sessions on relevant topics that people can have that will be covered through OHIP. So please, in a couple of weeks, we have a series on sleep coming up, as well as parenting resilience coming up in the next few weeks. So please see our website or Instagram for more information on those. Those are OHIP covered events. And again, we're really in the phase right now of just getting our name out and exposing ourselves to as many people as possible. So we would welcome any type of referral. If we can help you, we're definitely willing to try. I'm just going to open up the chat box. So I just see a couple of links that are posted. Thank you, Alicia. Thank you, Diksha. And Mel saying, I'm a parent and took away great information. Thank you so much, Mel. I really appreciate it. Any other comments or questions from everyone else? I'm not even sure if there's like the kind of the composition of people that are on the call. Are we on with family doctors? Other healthcare providers that are in the hospital, dietitians, social workers, physios.
It's actually a mishmash of healthcare providers in general. So
that's great. We're all for again, this is very much a team sport, and so we like to. I'm always talking to our other team members and learning from them too.
Okay,
Victoria.
Hi, Dr. Patel. Thank you so much for an excellent talk. This was really, really great and quite timely for me. I'm an emergency physician in Parry Sound, but I have 2 young children, and I recently have been doing more reading and learning about plant-based diet and that kind of thing. I'm just curious if you have, and I don't know, we went through that slide quickly with your resources, but specifically resources for child-friendly plant-based diet where you're just easing into things, and or like a website that you would refer to, or a book to purchase or something like that.
Yeah, for sure. So I have a whole, what I couldn't even show you is I have a curated email that I have ready to go for every family, especially on the topic of nutrition, because a lot of parents want to start with nutrition as a starting point. And so I'm happy to just forward you that entire email, and that includes blogs of different food websites based on ethnicity. So we always want to try to give people multi-ethnic choices, books, websites. I have it all in one email that I'm happy to push to you if you send us an email.
That would be amazing. I took your email down, so I'll fire you an email, and
thanks,
I would
Victoria.
greatly appreciate that.
Thanks. Really appreciate that you came, and please do feel free to be in touch on how we may be able to support you with your kids, but also the kids that are coming through the Emerge as well.
Yeah, absolutely. That's great. Thanks so much.
Anyone else? Thank you for it's really nice to see the faces that I recognize, but I really appreciate Jennifer, Becky, Mariah for joining as well. Open to any feedback, comments, even questions, even if you wanted to take it offline as well.
Okay. I'm not seeing anyone else unmute. Oh,
Dr. Kasim, I'm being on, they got interrupted with our code, a real code, emergency in the hospital.
Oh, no.
I came back 20 minutes ago. I was signed in as Mariah Steele, but it's actually myself, Dr. Ola Kasim. I really enjoyed the part of the talk that I listened to.
Thank you. Thank you very much.
okay. I'm not seeing anyone else. Thank you so much, Dr. Patel, for coming, and I'm sure we'll be inviting you back in the near future. to give us more detail. And as Dr. Kassem alluded to, yes, I actually ended up stepping out in the middle of your presentation as well. So I
No.
missed a little bit. I'm glad it's recorded.
No problem, it happens. And yeah, just really appreciate everyone's time and focus and energy and your energy. I could feel it even though we were from afar. And when I see Natalie and Milan on a screen, I always get energy, like always, right? They are beaming. They are the force there in Perry Sound. And Milan, I'm really grateful for you having me here today.
Thank you so much for coming. This was such a great talk. Like even Natalie and I were looking at each other like, this is awesome.
There's so much more, honestly. Like, I mean, there's easily a part 2, but I had to stop somewhere.
For sure. All right, I'm gonna let you go. Thank you so much. That was amazing. Thanks, Rikin.
Thanks everyone for joining.
Take care.
Thanks.